So one of the areas where many people come to us and they have an idea of the Medicaid facilities or the public health or public facilities being inferior. Good thing to remember here is that the Medicaid is simply a payer. They don't operate facilities. They contract with certain providers, certain services. They certify nursing homes to be able to accept Medicaid dollars because they meet federal quality standards. And they work with certain assisted living facilities, which are private businesses. For the most part, they're for-profit, but some of them are not for-profit. However, it's important to remember that all of these facilities, whether they're home care or assisted living or a nursing home, they're all a mix of private pay, residents and patients, and public assistance through the Medicaid program. So like anything, it's important to find the right facility that provides that personal touch, is available for easy visits from spouses or family members, and it provides that high quality, but they also accept Medicaid as a form of payment. So really not like a Medicaid only facility. It's more like there are facilities out there, and be sure that the one you choose is both high quality and accepts Medicaid as a form of payment. Another common misunderstanding is that Medicaid is really for the poor or for those who didn't have all the advantages that you may have had to save and work throughout your career. And the truth is, Medicaid covers long-term care costs. Long-term care is a very expensive cost. 1 month after another month of costs that will escalate for as long as you need that care. So those costs can easily dwarf the average middle-class American savings when it comes to retirement. And turning to Medicaid is no longer just a necessary step for those who may not have disadvantages or may be disabled. Medicaid now is a program that provides a solution for middle-class Americans to pay their long-term care bills. Another preconceived notion is that Medicaid has such difficult criteria, financial criteria, that it's just impossible to actually obtain those Medicaid benefits, that the caseworkers will throw anything out the window. And whatever it is, they'll take that application and just deny it, whether it's for an arbitrary reason or it's for something they just felt like doing that day. The truth is, although the process is difficult and the requirements are exacting, the policies that the caseworkers work with are publicly available information. These are really objective standards by which they work with. Caseworkers may have a bad day. They may not have all the information that they need to make a proper decision. But you can rest assured that their decisions must be based on policy. And when they're not, our team of Medicaid specialists and certified Medicaid planners will work with the caseworker and, if necessary, through the fair hearing process to escalate and resolve improper decisions so that the benefits are achieved when they are deserved. So another area we find many people come to us and it's a really common misunderstanding. They say, Medicaid's going to take my house. And this is a complicated question, and some parts of it are kind of true, and many people, if they don't plan correctly, do end up having to lose their home or not be able to pass it on to their children or their heirs like they had envisioned always being able to do. So It's not true that Medicaid will require you to sell your house, though, before you enroll. Medicaid allows you, in most circumstances, to exempt a home that's in the same state where you're applying for benefits. But many people have heard about something called Medicaid Estate Recovery. Now that is a program that can recover against the estate of the Medicaid beneficiary after they pass away. That's truly frightening, but remember that if there's a surviving spouse or there's a care worker, a son or daughter who is a care worker taking care of you in your own home, there's ways to protect that home for them or for your surviving spouse. And there's a lot of things you can do to prevent Medicaid from taking the home or taking whatever remains of your estate after you pass away.